When Riley was born, they told us that he had a hypoplastic right thumb, which means that his thumb looked like a normal thumb, but it didn't have the critical joint at the base for strength or in the midpoint of the thumb for dexterity. So although it looked like it was a normal thumb, it was not usable. At that point, we didn't know what our options were. We had seen other specialists. We needed to get multiple opinions. You know, that was critical. I think that when you make a decision, a surgical decision, when a life is at risk, you do it instinctively. But in this case, it wasn't a life-saving decision. It was a decision to better the quality of Riley's life.
Put your thumb on here just like that. Good. And make your thumb right in the middle. Yeah, perfect. I'm just going to move it a little bit for you.
We offer a congenital clinic. We see children with congenital differences of the hand,
which is open to any patient
your fingers out
and their family that are interested in having an evaluation.
At birth, his finger was always shaped a little different.
Again, he's adapted to writing left-handed, where he's right-handed in everything else that he does. So I'm sure that's affected his handwriting, and I'd like to be able to, if we can get any movement out of it, and that's what we're here for.
We have a lot of people that are probably going to come in here, and we're going to chat a little bit about the thumb.
Some of the most common cases we'll see are digit duplications. So we call these polydactyly cases where patients have extra fingers. Sometimes they are cases where patients will have abnormalities in the growth of their forearm bones or fingers. They may be short, duplicated, absent, webbed. There's a wide variety of abnormalities that we can encounter. This evaluation affords the patient and their family the ability to see all of our doctors at once. We put our heads together, so to speak, on how to best treat these patients. There are 14 full-time hand surgeons that work under our roof. That enables us to treat the common and the complex. Instead of having one of us weigh in, you get the benefit of having, we could count around the room. I think they're still spilling out into the hallway. But all of these brains weigh in and see if there's some sort of conclusion we can come to. Let's take a look at your thumb, if you wouldn't mind, Braydon. And tell me now, we were just discussing outside, does it hurt when you try your best to pull it down?
Yes.
It does hurt a bit. Your interest is to get your thumb as straight as it can be, I imagine. Any of your friends notice it's not straight?
Yes.
They don't say anything, do they?
we discuss with the family certain treatment options, be them surgical or non-surgical.
We needed to know that Riley was going to receive the best, and we knew that on that day.
The most important thing is to reassure the parents that they have a normal child with a difference.
When we came to Curtis National Center, the important focus that day was connecting with us on an emotional and a psychological level. I think any type of a situation like this will overwhelm you. And when we were led to Curtis, the moment we sat down, we knew we were in the right place.
Thank you.
Okay.
Thank you.
You come.
Say bye-bye.
Bye-bye.
Bye-bye, my friend. Sucking his thumb.